Laura, welcome to the show. How you doing?
I'm doing great today. Thanks so much for having me.
Thank you very much for joining. I think you're one of the first people that I spoke to when I set up the business 3 years ago now. So it's good to finally do this and yeah, get into your career. So why don't you start off by just giving us a very quick introduction, who you are, and what your current role is?
Yeah, sure. So I'm currently in a new role working with Loyal, who's developing a veterinary drug for dogs, which is an indication for longevity, which is something completely different than I've done previously. So I'm very excited about that. But it's, similar roles in terms of scaling and building out the quality systems, helping them to get inspection ready, seeing the company through the pre-approval inspection process, and really, building the systems to be commercial ready.
Yeah.
And then obviously, the post-commercialization requirements as well. So it's a lot of what I've done before. So I feel very comfortable in that space. The new piece for me, which is nice because it's a bit of growth and development, is on the veterinary side. So I'm excited about that. Yeah.
Yeah, that's exciting. Congratulations.
Thank you.
Well, we'll get into all of that. One thing that I wanted to ask is you've joined a lot of companies at that critical build phase period throughout your career. Has that been intentional? Do you find yourself drawn to those types of environments over time?
Yeah, I mean, I think I found my niche at one point. I started with biotech at a certain point in my career, small biotech. Actually, my first foray into that was with a rare disease organization, and I led their quality systems team. And that was, very dynamic, high growth and learning phase for me, and really, helping the team understand what's important about quality systems and how we get through the whole, regulatory inspection process. So I kind of got hooked after that, like that was, I think it just became my passion. But then from there, I really decided, okay, so let's move beyond just quality systems, and decided I really wanted to move into a quality leadership role that was more sort of broad GXP. And so that's what I did after that. That company was acquired. And then I moved on to another role where it was sort of, just leading a full quality organization from, GCPs all the way to GMPs and post market safety and everything. So that's really where, I've stayed the last couple of companies where I feel I'm providing the most value. And I think that's sort of the area in quality where I think it's challenging to find somebody that can split their time between, all of those GXPs and speak to it with a certain level of understanding and subject matter expertise, right? It's a
Right.
little difficult to find in the industry. So I've enjoyed doing that. And I think that's really kind of where I bring the most value.
And what was your first? So when was that first role when you stepped from the quality systems role into the broader GXP environment? Who was that with, and when was that?
Yeah, so I was with NPS Pharmaceuticals that was acquired by Shire. And so that's where I was heading up their quality systems team. And then I moved into a role with Amicus as their VP of quality. And so that's where I helped them kind of really, they're a rare disease also at the time, small biotech, were looking to get their first product approved and on the market. And so that's where I really helped them build out their team, which had been a little bit GCP focused at the time because they were in development. And so we really built out the quality organization to support, the commercialization piece, the quality systems piece, everything, from building out their management review process, and all of the commercial procedures that were needed. So that was my first really broad GXP role, and I enjoyed it so much, supporting the team and helping them through that. And especially as a rare disease organization, it brings a number of, different challenges with it, because every patient is so important, every subject is so important. And so I was really drawn to that, that was, the patient centric approach in that company was extremely strong.
Yeah.
And so I really valued that too.
Did
Yeah.
you know somebody at Amicus when you got that role?
No, I don't believe I did.
Re-
I interviewed for it and
Yeah.
yeah, and just got the role. I hit it off with their head of technical operations,
Yeah.
and I think he was really looking for someone that, could bring that full, GXP, but really more on the GMP side, right? Because
Mm.
the CMC piece was so important at that time, right? You're moving into like PPQ batches and validation, and, you're working with your suppliers. And so you need a strong quality partner. And I think that's what they were looking for at the time.
Yeah. The reason I asked that is because it's a big step up when you're going from a systems, very specific systems related
Yeah.
role to a broad
Well,
VP
so
quality.
actually, interesting you say that because they actually thought that at the time too.
Yeah.
And so I said, that's fine. So they put me in as a senior director for a brief period
Okay.
of time and then promoted me.
Okay.
And I, totally understand their rationale for doing that because it's like, come in, demonstrate yourself, and then we'll do the promotion. And they did. And so, when I got there, I was leading the team at that level, which was fine. I mean, you have to really show that you can do the job. So
Yeah.
it was a bit of a leap in that role for me.
Yeah.
And you make mistakes along the way, right? It's never perfect, but it's a big growth opportunity for me.
Huge.
Moving
Yeah.
into that.
They've obviously seen something in you. Then that's the reason I ask is like I mentioned, when you know somebody, it's a step up. They know who you are. There's an element of trust
Sure.
there. When you're an unknown entity, it is a bit of a leap of faith. So they've obviously seen something in you, given you the senior director role, and then promoted you into the bigger role.
Yeah.
When you look back at that time, what were your key learns, the challenges that you faced stepping into that broader GXP position, and then what characteristics do you think you displayed that gave them the confidence that you could take the bigger job?
Yeah. I think that the biggest challenge for me was really navigating the organization, navigating the management team, the executive management team, which had been really a first for me, in doing that. And I really did partner with others in the organization to learn how to do that. And I'm very lucky. I had great mentors, in my career and great role models. And at Amicus, I had one that I really sort of attached to, like when something would go wrong and I'm like, okay, I need to step up, and do my job now. I would look to this person and be like, okay, how do I navigate this scenario right now? And he was always there to provide me guidance because he knew the management team really well. And he was able to sort of, help me through that process. And that's where I really learned, that you can't retreat when things go wrong. Like that's when they're looking for quality to step up.
Yeah.
What do we need to do? Tell us, explain to us what we need to do. What's the process? I think we had like a critical complaint maybe coming from the clinic at one point, and so, they just want you to address it head on, like, okay, what's the issue here? What do I need to know? What's important? Where are you taking us? Where is this investigation leading? And so you have to really step up and address it quickly because otherwise there's a swirl of information around things that happen. And if you don't control that properly, that communication and provide
Mm.
direction, then that can kind of just take everybody off track and make everyone a little nervous about, what's
Mm.
going on. So you really do have to step up quickly
Yeah.
and address situations as they happen. And that I learned quickly in that organization.
Yeah, it's a really good point when you're stepping into that exec leadership role and you might not have experience of dealing with communicating with the board or C-suite. What do you think are some of the key things? You mentioned their communication and being proactive there. What are the key things when it comes to successful communication as a quality head with the executive team, and where do you think some people or some leaders potentially may get it wrong in
Yeah.
that communication piece?
Yeah. I mean, I think what they're looking for is, what's the guidance? Bring it to me in terms that I can understand and bring it to me with a sense of, confidence that you know what you're doing. You never want to walk in and be like, well, maybe we should do this and maybe we should do that. You walk in with a plan, you're confident in what you're doing, and you're calm in your approach and very, calm and pragmatic. And so they're thinking that, okay, she knows what she's doing. I have confidence in her. I'll accept her recommendations. So I think that's really important when you're dealing at that level. I think not just at that level, but I do think generally the organization looks to the quality leader for bringing a sense of calm because everybody wants to do the right thing. I find that across every company. People don't always know what the right thing to do is. And so sometimes they get nervous, when things happen, if there's a recall or something.
Yeah.
And so you really have to step up with a sense of calm, a pragmatic approach, bringing a sense of confidence to the organization that these things happen.
Mm.
We have a process for this. We're going to walk through it and, describe exactly what's going to happen over the next few weeks so everyone understands, and really, I think, translate the regulations and the guidance for them so they understand what is the FDA looking for, the regulatory bodies. So I think bringing that not just to the management team, but to the organization is where quality leadership can make a lot of impact and bring a lot of value,
Yeah.
because I think it gives people a plan and a sense of confidence in where they're headed.
Yeah. No, I agree. So going back to Amicus then, how long were you with Amicus for, and how did that just sort of career journey play out?
Yeah. So I was there I want to say about 4.5 years.
Yeah.
And we actually did get one product approved and on the market, and they were still developing their other drug for Pompe disease when I left the organization. I decided, really just for personal reasons, my husband and I took, a journey to the West Coast, and we decided to live in San Diego for a few years. And so I took a position with Heron Therapeutics as their vice president of quality. And I did that for about 6 years. And it was, very similar. They were looking to get their product through phase 3 and commercialized, building out their quality systems. Again, a broad GXP role, but it was international, not just the U.S. So we were working, with different regulatory bodies, and so that made it a little more interesting too.
Yeah. So let's talk about that sort of scaling journey that you've been on with Amicus, Heron, and throughout your career. I suppose when you walk into an organization where the quality infrastructure needs building, what's the what's the blueprint there? Like, is it exciting? Is it daunting? Is it a bit of both? And how do you go about assessing the key priorities in your first 6 to 12 months?
Yeah. I tend not to get overwhelmed initially. I mean, my approach is to really listen, understand where the organization is at, what are their key priorities, what are their business objectives, and to work back from there. If they're looking to, do a submission in the first half of next year, then what do we need to do to be ready for that? And what are the quality organization's key goals and priorities? And then put the plan in place. So I think working backwards from what the company's goals are is important. But almost every organization I've been in, there's gaps, processes are not in place necessarily. And, it takes time to work through everything. I don't hesitate to quickly do gap assessments because that will flush out, what needs to be done. Some organizations are in better shape than others, but, you can quickly get your hands around things with the quality systems if you do those gap assessments early and bring in the right resources. So, I think that's important, but you can't get overwhelmed by these things. They happen, and it's really about continuous improvement, right? Like, if you can demonstrate that you started and this is where the quality systems were at, but you're making these improvements and you're closing the gaps, you're self-identifying issues, which is, I think, where you want to be. You want to be
Mhm.
the ones to identify the gaps and the issues and have plans in place to remediate them. You don't want regulators to come in and find them. So
Mhm.
I think that's where you want to be, and so, again, I think the business priorities and the business goals are probably the most important thing.
Yeah.
Where they're headed, are they looking if have they done their submission already, and now you have to get inspection ready, right? Which is a whole other challenge,
Mm,
and putting the inspection teams in place, and not just the quality systems, but that whole process to
mm,
support it. And when you're in a GXP role, there's multiple work streams with
yeah.
inspection readiness. You have your BIMO inspections, you have your CDMO. So you have to really quickly come up to speed on each of those, on what needs to be done and who's leading those efforts, and putting your timelines in place and
Mm.
executing on a plan, because it goes very, very quickly.
With them, you mentioned the organization goals and strategy there. And I was having this conversation with somebody the other day, another quality leader who's spent a large portion of the last few years reporting into a CEO, and then went to a different role reporting into a chief development officer or chief technical officer. And it's slightly different, not reporting into the CEO, getting direct access into the CEO. What's your take on that when it comes to that, really understanding the company strategy and aligning the quality strategy with the business? And is there any difference when you are actually reporting to us directly to a CEO?
Yeah. I mean, I think there can be a big difference, but I think it does depend on the organization. And what the CEO believes and what the organization believes in terms of the value of quality and what it brings and the importance of the organization. But every organization is different, and the people in the organization, the structure of how the organization is all different. And I tend to find it's individualized, right? In some organizations you have limited access to the CEO, which is not a good scenario.
Yeah.
And so that's where things tend to go astray a little bit. If you don't report into the CEO, that's fine, as long as you have access and you're able to communicate and share, escalate, things like that, and gain resources and gain support. So I think it's really kind of less about a reporting structure and just more about how much availability they have and how much they support quality. So I think, yeah, the reporting structure, it's great if you can do that, but if not, I think there's probably
Yeah.
other factors that are more important.
There are other factors, and it depends on the company size and all of that
Yeah.
sort of stuff. Yeah, and I was reading your LinkedIn, and you actually wrote a post about how quality systems that work at a smaller number of people, maybe 30, 40 people, often break when they get to 100, 120, 140 people. Tell me a bit more about that. From a scaling perspective, what does that look like in practice, and what are the first things that sort of crack?
Yeah. So I noticed that sometimes in smaller organizations, people can do more. And so they build their processes somewhat inefficient, because it's just a couple of people. And so it's no big deal. But then when you start making more batches and you start having more quality events, and you have to, the volume of things is substantially higher, those processes now are less efficient. They're more time consuming, and they're kind of holding up the business. And
Mm,
so I think you really need to, by scaling, what you really need to do is reinvent that process a little bit, make it more efficient so that it works for the higher volume, the more number of people. Maybe there's more reviewers and approvers or whatever it may be. But you do need to make sure that you can scale it so that it's efficient while still being compliant to work for where you're headed, right? So you have to think ahead a little bit, right? Is this process going to work a year or two from now when we're making 120 batches a year or whatever it is? Thinking ahead, putting processes in place that make sense, that are not going to break. I mean, that happened in a couple of organizations to me where I had so much feedback from the team that was like, we can't do this anymore. It's just not working. We have to fix it. And so, unfortunately, you have to go back and do that. But, if you can start from the scratch, from the ground up, and build systems that are scalable and will work when, in a couple of years when things look different to the business, that's the best place to be. But that doesn't always happen. So you
mm.
have to go back and fix things.
So do you think it's more of a systems and processes problem versus a people problem when you're scaling quality? Like, where do quality leaders typically get it wrong when they're scaling quality teams?
Yeah, I do think, I tend to focus more on the systems and the processes rather than the people. So I do think it probably has more to do with that than the teams themselves. But, as companies grow, you're also bringing more people into the organization. People have had different experiences, different understandings. They want to see things look differently, but, you can't make everybody happy in a
Yeah.
quality organization. You have to build your systems so that they're compliant and efficient. And so I tend to focus more on the systems and processes and putting something in place that makes sense.
Yeah. Um, inspection readiness gets talked about a lot, but often it can mean different things to different people. In your eyes, how do you define inspection readiness in practice?
Yeah, I mean, I think it's a lot of things. I think it's getting the team ready to be able to support an inspection internally, but also at your CDMO. The more challenging piece is at your CDMO, of course, right? Because you have less control over what happens there. And so your influence over them becomes more important, and your
Mm.
partnership with them becomes more important to be able to facilitate them being inspection ready. Now, every CDMO is different. Some have more experience in this than others, and you may have to do less or you may have to do more. So I think that depends. But internally, I think it's getting the team ready so that if you're a subject matter expert, you know what your role is. You understand your role. It's clear. You have guidance from quality, what to do, what not to do, how to interact with regulatory authorities. There's a very clear process for bringing documents into an inspection room. Like everybody understands what the process is. No one is circumventing that. Things are not chaotic, they're under control because
Mm.
inspections can get, challenging. And so we want to make sure we have a really strong process in terms of how to, triage requests from the agency. Where are those decisions made? Who's making those decisions? How do those get communicated into the inspection room? So people need to understand the flow of information, the flow of documents, the decision-making process and their role, and have a lot of clarity around that. And then having all of that in place tends to bring, less chaos, more structure, and being able to facilitate the requests easily. But it's not just the process, right? It's going back and looking at your quality systems and saying, okay, are our change controls robust? Did we
Mm.
do the appropriate impact assessments, and understanding where you need to fix things there. So there's so much to inspection readiness that you have to really manage to go backwards and look at things and also support the team to be ready when the day comes. So it's challenging, but that's probably the part of the role that I love the most.
Have you had many situations where you've gone into an inspection and thought you were ready, but the inspections revealed something unexpected?
Yes. I mean, that happens, more often than not. And you really just have to methodically walk through it and try to understand what happened, what went wrong. Is this something that can be fixed before the agency leaves,
Yeah.
so that we can correct it? Or is this something that we're going to have to just respond and put a CAPA in place? And,
Yeah.
so how quickly can it be remediated? And then, what's the impact? Is it a data integrity issue? Is this
Yeah.
going to hold things up? And then when that does happen, who do I need to communicate to? Who needs to know this information
Yeah.
so that they're not surprised at the end of the inspection, and realize, okay, now we have a problem. This is going to hold up our application or whatever it may be. So I think quickly assessing situations like that and saying, okay, is this going to impact data integrity? Is our data protected? Is it safe? Or is there some other issue here that's going to hold up our application? And if not, great. But you have to assess that pretty quickly to be able to communicate with management so that they understand.
Yeah. Um, so I want to talk about a bit about leadership and team building and your sort of philosophy. What type of leader would you say you are, and what's your leadership philosophy?
I really want my team to be empowered. And so, I'm not the person that's going to give them a ton of direction, right? Unless they're, very junior and need it. But, I really want people to step up, to take ownership, to take initiative, and to give me their thoughts on where they think things need to be headed, and I'm happy to weigh in. So I ask a lot of questions. I have an open door policy. I'm here, but, I expect that, you're competent in your role, you know what you're doing. And if you need advice or need to escalate something, then let's talk through that. So I tend to be, I listen actively. So when I'm in a one-to-one with somebody, I'm letting them talk because sometimes people just want to say things, get it off their chest, or just make sure, that they're headed in the right direction. So I tend to listen more than anything. But I do, I want to set the overall direction for the team in terms of what the priorities are. And so that's important too, especially when you're first coming into an organization, because the direction may be different than, where you want to head. So I think quickly understanding that and communicating that to
Mm.
the team is important. But yeah, my leadership style, I think, is very casual. I want to be able to have, easy conversations with my team. I want to be there to support them because I understand I've been in their role before and I do understand the challenges that come with it. And so I want to be able to support them. And if there's issues that they're having, I'm here for them. But I do want them to, kind of learn how to navigate that themselves.
Yeah, yeah, yeah.
Yeah.
And then when you're hiring people and growing your team, what are you looking for traits wise in people?
Yeah, I mean, I think, I think self-starters are really important for me. But I think somebody that, if I'm in an interview, if the conversation doesn't flow, if it's not an easy conversation, that's probably not a good start. I want someone that's easy to talk to. You have to have good communication skills, and I think, understanding if that person is going to be a good fit in the organization. I mean, if you're smiling during an interview and you're enjoying the conversation, I think that's
Yeah,
great because that means, okay, this is somebody I can work with, you know.
yes,
And that partnerships are really important, especially in quality, right? And being able to do that because, situations can get tense or there can be disagreements, but you always want to have someone that you can work with. And so I think the cultural fit is extremely important, but being a self-starter. And I think especially in quality, if you can give people a sense of, can respect their decisions and have confidence in their decisions, I think that's really important too. Yeah.
and you touched on it earlier, but how about managing upwards and managing sideways with your stakeholders in regulatory or clinical and commercial and managing upwards? What's your approach to that?
Well, managing up, I think, is important, but I think how you do it is just as important. So I tend to do that a little bit more behind the scenes, in one-to-ones or conversations, and just really kind of setting the expectations that way and saying, this is something we really need to take a little more seriously or, whatever it might be. Usually management listens to that. If you bring your justification for it, they'll usually listen. But, that I think you have to do a little bit more carefully. So that's not something I'm going to do in the middle of a meeting. I'll take it offline and have some conversations that way. Or I'll also, work with other leaders in the organization that maybe share my opinions and, we'll sort of attack from different angles, if you will, and support each other if we feel that that's necessary. And so sometimes that's a good approach too, is finding others in the organization that really have the same opinions that you do and want to set things up so, in a certain way. So collaborating with them and sort of influencing together the organization, which is much more powerful than just yourself.
Yeah, it's funny. Like I mean, you strike me as somebody who is calm, measured, a very good listener. You um, probably think quite deeply into the situations before sort of jumping into a situation, and you're measured in that sort of way of how you communicate and how you lead. And I think that's a trait that I see across so many good, strong quality leaders is that calm, measured approach rather than
Yeah.
that panic, and that's ultimately how a lot of people progress up the ladder and get to the highest role in quality, isn't it? It's how they react under pressure, it's how they communicate, how they manage upwards.
Yeah. I think for me, I've been very lucky. I've had a lot of good role models over the years, and, a lot of them female, but people that bring an sort of an executive presence with them. And I've always tried to emulate that. And I think that's probably one of the most important things, especially when you're dealing with the C suite, is having that presence. So they're listening, and they're hanging on, your words because they want to hear what you have to say. But I can name to you different, individuals that I've worked with over the years where if they walk into a room, like, they're there, like, okay, we can start the meeting now. This person is here because we want to hear what they have to say, And that to me is that executive presence where, they're strong leaders and people want their opinions, and so I tried to emulate that too. I think that's really important. And I'm so grateful that I've had people in my career. And I would say to others, find someone in your organization that you respect like that. I would say observe, listen, watch, and emulate as much as possible. Because that takes quite a bit of time to develop that presence, and that sort of seasoned approach to quality. It doesn't happen overnight. And so I think in the course of your career, where you can find those really good role models, hang on to them as much as possible, and I've followed them to different companies because I really enjoyed working with them and have learned so much from them. So I think that's important. The sense of calm, I think, again, in quality, when something goes wrong, people look to you. And so that's when you have to be your strongest. And that's happened to me time and time again. And, sometimes you flub it. Sometimes, especially earlier on in my career, you make mistakes, but you learn from that. But when something goes wrong, yeah, they want quality to have that sense of confidence, that calm, we have a plan, we have an approach, everything's under control and we're going to do the right thing. So let's not panic and let's just move
Yeah.
forward with the plan. So that, yeah, I think that's really important too. Yeah.
Do you think you were destined for a career in quality? Were you always like? Did you always display those traits as growing up?
I never really thought about it, but maybe. I mean, I think once I got a taste of it, I realized, oh, I'm pretty good at this. I like it. I enjoy it. And I think I had the right demeanor for it. And so I think that's why once I started in quality, I just took off with it and I said, okay, this is where I'm headed for the rest of my career. I kind of knew it because I think my character and my demeanor, I think, really was good for this type of role. I don't think everyone can do quality.
No. I think that's a good word, demeanor, and how you put it, because I think that's important. And you're right, not everyone has that demeanor and has those
Yeah.
traits that can do
Yeah.
quality well. And Laura, I'm conscious of time, and I've really enjoyed this conversation. But I know you've just started a new role. But when you look ahead into your career, what are you excited about, and where do you think you can take your career?
Yeah, that's an interesting question. So recently I was talking with someone and they were like, have you thought about being a chief technology officer? And I'm like, actually, I haven't. And then I thought, well, what if I wanted to take my career there? Like, how would I progress it now to be able to do something like that? And so I haven't really answered those questions yet. Just started a new role. And so, when that happens, you're really focused intensely on being successful in the new role and, supporting the organization and everything that you need to do. And so you're less, focused on your own career. But I do think at some point I'll come back to that and say, okay, what's next for me? Is this it? Or am I looking to, or maybe regulatory, right? I don't know. And what would be my pathway to get there? So I think once I, settle down, I'll start to think about that. But for now, I'm really sort of immersed in this new culture and company with a new team and processes and challenges and opportunities. And so I'm kind of more focused on that. But, at some point, I really have to kind of revisit that.
I think it's great because I'd love to see more quality leaders like yourself go into that sort of C-suite role, whether
Yeah.
that's chief quality officer, chief quality and reg officer, or
Yeah.
chief development, chief technical, whatever it may be. There's a lot of examples of people that have gone into. I had a lady called Maya
Yeah.
Peterson on the podcast who was site quality, gone into chief quality officer, and is now COO at Fujifilm,
Mhm.
and a few other people. So it's but I think more quality leaders have that potential, and maybe people stop when they get to that head of quality, VP, SVP
Mhm.
level, because they don't see a path ahead. They might go into consulting, but I
Yeah.
would love to see more people go down that route.
Yeah, I agree. And I think it is a little more challenging when you're in a quality role to move into something more technical
Yeah,
versus if you're in a technical role and then taking on quality. So I think you
yeah,
find that more than the other way around, but
you do.
still achievable.
Yeah, yeah, you do. All right, really enjoy the conversation. I suppose just to cap things off, if you were to go back and speak to yourself at the start of your career, what advice would you give your younger self?
Yeah, that's a great question. I think I would say decide where I want to end up or try to understand where I want to end up so that my career path would be less arduous. I mean, I got there eventually, but it certainly took me to all different types of roles and companies and responsibilities. If I had thought ahead a little further, I think it might have been a bit of an easier journey. But you know what they say, I mean, the having a difficult journey, I think makes you also a stronger, better leader. So that's fine too.
How about aspiring quality leaders, people that are earlier on in their career now? Would love to go into a leadership role, would love to be a head of quality one day. What advice would you give them?
Yeah. I think I would say learn to work with the business. It's not all about compliance. I mean, the patient safety aspect is non negotiable. And while we want to be compliant, we also want to support the business objectives. So I think helping the business find ways, solutions that can be compliant brings more value to the organization. And I think if you really want to get into a leadership role, you have to transition from, okay, I'm operational, I'm tactical, I want to make sure we're compliant to how do I support the business and how do I help them achieve their corporate goals while being compliant. So I think it's putting on a different hat, if you will.
Brilliant. Laura, thanks so much for your time. I know you've just started a new role, so you're probably extremely busy right now building and scaling systems and teams and processes. But yeah, really appreciate you coming on the show. And we'll definitely have you back on in the future. We'd love to see how the role evolves and also maybe see how that role as a chief technical officer or chief technology officer maybe pans out in the future. But no, good. Best of luck with everything this year. And thanks again for coming on.
Thank you so much. I appreciate it. Thanks for having me.
Pleasure.